Welcome back to my channel, and today I'm here to talk about the signs and symptoms of PKD from my childhood up to date. All the signs, all the things that indicated that something was wrong, and some were taken for granted, some are not talked about. There's not much awareness. It's like most of the signs that are recognized are the signs usually people feel when they're adults, and things they start to notice when things start to go bad. But there are little signs you can see from a child and from your family members that are going to make you to start to look deeper into why the kid is doing that, and why that's happening to the child, and maybe that's going to make you to have them checked up and see if they have this issue. So like my signs and symptoms did not basically only happen to me in the family. From what I hear, my mom experienced similar signs and symptoms, and she has hypertension. She has never told me if she has PKD, but she has been treating hypertension. I don't know after what the doctor told her if she checked her kidneys. So I suspect it's the same thing. But I wish when my mom started having these signs and symptoms, if her parents were aware, they would have had her checked up, other than thinking these are normal things kids go through. But because not all the kids are going through these things, I want to be able to give this awareness such that you're able to look out for your children and see what's wrong with them. Some of these signs may be things you experience when you have other issues, other diseases, but just keep caution, keep watchful, and this way you can be able to help your family members better. This one made me basically dive deeper into, I stepped back in time to see everything I was going through in my childhood, everything I could remember. Stepping back made me realize that everything makes sense. Everything makes sense why I went through all those things, and why some of my family members also went through these things, why some children in our family line still go through these things, and now I know where they're going to head. But it's kind of hard for me to disclose this to family members. Even speaking about my condition, I'm not comfortable speaking about my condition with family members, because like when you talk of a kidney disease, everyone is terrified. So I don't want people to look at me with this kind of empathy. I don't want people to feel sorry for me. I want to live normal, because I know life can't only be determined by this. My number one sign was being weaker. With PKD, even in your childhood, you're almost like most of the normal kids. You can do a lot of things, you go through a lot of things, but you don't do them as well as the other kids do them. For example, with me, I used to struggle with carrying jerry cans. In an African setting, you would go to the well or the spring to fetch water, and the kids of my age, I remember around 10, 9, they were already carrying 10-liter jerry cans on their head. They would put their own 10-liter jerry cans on their head. But with me, it took me longer to learn how to do that than the other kids. So like if they did that in 3 months time, it would almost take me 6 or 9 months to learn the same thing. So even playing, I would not want to continue playing as much as the other kids wanted to continue playing. So being weaker, I feel like in children, this one is hard to notice. It's not something that you're going to observe right away. But another thing is, like, most times the kids are not playing around you. Maybe you can be able to see this when you involve them a lot when you're so much involved in your child's life. But my mother was not so much involved in my life. My grandmother, like, we used not to play with our parents. So it's going to be noticeable if you're so much involved in your child's life. And the second issue is I had I had hunger issues. Hunger issues as in I wasn't constantly hungry, but there was a case whereby if I missed a meal, especially an evening meal, there was this terrible hunger I felt the next day, to the extent that I wouldn't get out of bed. I couldn't have the energy to lift even my arm or even put food in my mouth. I always had those episodes. Sometimes it didn't even come from missing a meal. Sometimes it just happened out of the blue. Sometimes I would go to school and have that kind of episode, and then I remember I have a grandmother who lives close to school. So what I would do is I would ask for permission from the teacher to go back home, and I remember I would drag myself slowly because I didn't really have the energy to even move. I had to drag myself slowly to her home, and all this time as I was going there, all I prayed for was to find they had not eaten the next meal. Most times when I reached there before they had breakfast, I know if I ate that breakfast, that issue would be resolved immediately. And with this hunger issue, the minute you eat, everything becomes clear. All of a sudden you can run, you can do what. But before, when that happens to you, when you have that attack, you can't do nothing. You can't do anything. It's like you can't. I remember my grandmother would go and wash my face in bed, start to feed me in bed, and then after giving me the first 3, 4, 5 portions of the meal, I would rest a little bit and I would sweat. Then after that, I would have the energy to continue again with the meal. So this same thing happened to my mother from the stories I had, this hunger issue. So if her parents were aware, I think she would have been diagnosed earlier, and we would have saved ourselves a lot. We would have known from an early age that this was something that was going to happen to one of us. And I still see this happening in my family. I see children like that in my family. So the third one is reaction to certain drugs. And I don't know if this happened to a lot of people, but I had this terrible reaction to chloroquine. I remember when I was younger, like there were a few drugs to treat malaria. We had quinine, we had chloroquine, and you had literally no options. One was worse than the other. So the chloroquine would make me more sick than the malaria itself. I remember in my childhood, whenever I took chloroquine, I couldn't look at people up straight. I had to tilt my head like this to look at people. It's like the whole world turned upside down. I would feel constantly dizzy. I had no appetite. The only appetite I had was for sour things like lemons, tangerine. I did not desire anything salty or sugary. Just having malaria or being tested for malaria was one of the worst things that happened to me in my childhood, because I knew this I would have to suffer from the malaria, and I would have to suffer from the effect of the drug, which included vomiting, and I would also have to suffer from the weakness because I wasn't eating. Number 4 is issues of anxiety, being shy, and lack of expression. I've put them all in the same category because I feel like they are correlated. I've said it several times. In my childhood, I was always shy, but when I look at it now, I think it was not only about me being shy, it was about how I felt, how anxious I felt to say anything to anyone, including my parents, my guardians, the people I was living with. Most times it's kind of hard to express yourself, and when you do, you come off as if you're mean or arrogant. It's like you want to be heard or you feel unheard. That's why I put them in the same category. For number 5, we have respiratory infections. So with this one, I started to see this the last 2 years of my primary and the first 2 years of my secondary life. This was around when I was entering teenagehood, and had this kind of irritation in my throat that it irritated me, but I didn't have to necessarily cough. So all I did was I would try so much to clear my throat, because it wasn't pushing me to cough, but I needed to clear my throat. So all I did was this is what I would do to clear my throat. And I remember each time I did that, I would have, my eyes would water up so much, like people thought most times I was crying. And that I had that for about 3 to 4 years. The last time I had that respiratory infection, I was at school. The school was concerned. They contacted my parents to find out if I had asthma, if I had any other issues. I remember the school nurse giving me an injection, and that's how that sign ended. I never saw it again. But the reason I've put it here is because my sister right now is going through a similar thing, where she has this kind of irritation that now she has been put on asthma medication. Some of these signs and symptoms could be similar to other diseases, but I had to put up everything I went through, everything I noticed, everything I could see from my childhood up to date. And the 6th is that I developed rashes. So I feel like here, from the 1st to the 6th, I've put them in an order from childhood to secondary. So after the cough had gone away, after that respiratory irritation had gone away, I remember the next year or the year after that, I started developing rashes around the creases of my arms. I had that even up to around 2 years ago. Up to around the time, even after I was diagnosed, I still had those rashes. I think these rashes directly had to do with what was happening to my kidney, because I remember the rashes on my right arm. The rashes on my right arm were always worse than the rashes on my left arm. They found my right kidney was more grossly enlarged than my left kidney. So my right kidney was like 19.1 or 7 centimeters large, and my right kidney was around 15 or 16 centimeters. So I always had the worst rashes on my right arm, and on my left arm were not as bad. For our 7th symptom, we have fatigue. It's not something very prominent when you're younger. With time and with age, the fatigue gets worse. Number 8 is gaining weight, stroke, being chubby. This one, most PKD patients will testify to this. Me personally, I've never been really excessively fat or obese, but I remember always being chubby. Like I didn't have muscle to myself. Even now, I don't have the muscle I need. I'm still building it. I work out every week, 3 times a week. So I was, from my teenage life, I kept on adding weight, and it was not an excessive weight, but it was just chubby, that you felt soft. Most people don't know whether to classify you in being skinny or fat, because you're in the middle. You're in the middle between skinny and fat. You feel things don't fit you well because there's always some extra skin, there's always some extra stomach, there's always some extra flesh somewhere. Our ninth sign or symptom is big midsection, bloatedness, and feeling congested after eating. I put these all in the same category because I feel like they're almost the same things and yet they're different. So having a midsection is kind of expected because your kidneys are enlarged. They're not the normal size. So it's almost impossible for most PKD patients to have a flat tummy. They always have a certain bulk somewhere for the extra kidney to set in. So it's my midsection for some time has always been bigger. And the first time I tried losing weight without knowing I had PKD, I struggled with reducing my midsection. I would always do a lot of exercises for my midsection, for my abs and so on. And bloatedness, I feel like each time you ate, you would get more bloated. Like if you eat breakfast, there's that bloatedness, and then lunch, and by the time you have supper, like you're fully bloated. You can't wear the clothes you want to. I feel like bloatedness is self-explanatory, like you're gassy and so on. And for feeling congested after eating, it's basically what it sounds like. After having a meal, you would feel congested. 11 is back pain. I developed back pain pretty much in my early 20s. I already started having back pain. I think if you look at things like you have extra weight to carry, an enlarged kidney, and your kidney is pressing against some nerves, that could cause the back pain. So I always had this back pain from my early 20s, and it's been with me. It's been with me for a while. Next is pain in the kidney area. So for pain in the kidney area, I think I started to experience this mostly in my mid-20s, because most time I would only experience the pain when I overate. And I always thought to myself, do I feel that pain because I've overate and gained weight overnight? Like, that's how I could explain. That's the best way I used to explain it to myself. The real pain in the kidney areas kicked in after I had been diagnosed, and when they put me on all these types of medication. I remember I was taking like 21 tablets a day when I came out of the hospital. I was taking a lot of tablets a day. So that's when I really started to feel my kidneys were hurting. Passing of septic gas. So now for this one, and this one mostly happened also when I overate, and it happened mostly in my early 20s, because I noticed when I passed gas, it always smelled like someone was emptying their sewer. That happened for some time until a few years later, I also started to pass gas that was odorless. So for me, it was a relief for me from passing gas that smelled that bad to now passing odorless gas. I felt it was a relief, but I don't think it's a good thing to pass odorless gas. I can't really explain it, but it seems my gut wasn't healthy. I felt it was a relief going from this extreme to the other extreme, but I don't think it's a good thing. So that brings us to anger issues. I know for a fact I've had anger issues for a while, and it's always small things that trigger me, like something very tiny that wouldn't trigger a lot of people is usually something that triggers me. And I feel like this is due to hormonal imbalances. Your adrenals are responsible for balancing your hormones in the body. So if your kidneys and adrenals are exhausted, if they're not fine, you're going to have anger issues, struggling to lose weight. For the longest time possible, I've been struggling to lose weight. And from working out previously, before I was diagnosed with PKD, I remember, if you saw the previous video, I only lost 2 kgs. In that photo, I only lost 2 kgs. I know my midsection got better, but I only lost 2 kgs. So I have been struggling so much to lose a lot of weight, but it seems every time I stopped for only a few days, the weight would come back on. Lately, for some good reason, which I'm going to tell you, I've been able to put off 4 kilograms. And I've not even been consistent with working out. I got wild yam. One of the things that Yaki Awakened recommended for detoxifying the kidneys and adrenals was wild yam. When I started chewing on that wild yam is when I noticed I was losing a lot of weight. Because in December and January, I wasn't even consistent with my workouts. But I'm telling you, I went on the weighing scale and everyone was telling me, you're becoming so skinny, what's happening to you? Up to now, people tell me I'm losing so much weight, what's happening to me? The weight you're losing is not fine, but bro, you don't know what I'm going through. I have to lose this weight. The wild yam is really detoxifying my kidneys. Without even doing so much, I've been able to lose weight. Most times, like when people talk about these things online and you don't try them out for yourself, usually you don't know if they work or not. And I really wanted to try it out and know. The wild yam, guys, if you're doubting it, the thing works. Go and get yourself wild yam and start detoxifying your kidneys and adrenals. You really need it, because I've seen the benefit of the wild yam. Right now, I weigh 66 kgs from 71. So next is foamy urine and blood in urine. This I started to notice in my late 20s and my early 30s. And on top of this, I want to add frequent urination. I would get up several times in the night. My urine was always foamy and the color was always brownish or brownish red. Years prior, I wouldn't be the type of person that got up in the night to urinate. Probably if I did, it would only be once a night. So by this time, I was getting up to 3, 4, 5 times a night. Our next symptom is high blood pressure. Most times for PKD patients, it's one of the indicating signs, and I feel like people don't explain into detail what really happens. With PKD, it's not only going to be the higher number that is high, it's going to be both the systolic and the diastolic. Systolic for when your heart is, the pressure when your heart is pumping blood, and diastolic is the pressure when your heart is resting. Next is shortness of breath. I think I explained a lot about this in my previous video, and it's always, you feel suffocated, you feel out of breath. Sometimes you wake up in the night and you feel like your heart just stopped pumping. Usually comes with heart palpitations and hot flashes. These things, I feel, move together. Most times they move together. Next is constipation. It reached a time in my life where I felt I was always constipated each time I went to ease myself. I would sometimes even eat things that didn't have to necessarily constipate me, but I would always feel constipated. And this constipation is going to lead us to our next symptom, our next sign and symptom, which is hemorrhoids. With this constipation over time, I developed hemorrhoids, and the hemorrhoids is basically comes when there's tension around that area when easing yourself, and that causes your veins there to burst. So the blood that has burst clots under the skin. But ever since I started implementing more fruits in my diet, I've started to notice that the hemorrhoids are shrinking. They're basically going away on their own. And most people feel they have to be operated to have their hemorrhoids dealt with. It's funny how all these things I've listed, like people are treating all these things as their own, as diseases, and yet these, for me, these are symptoms of the polycystic kidney disease. Bad breath. For a period of time, I had bad breath, and I noticed when I stopped taking sugar is when my breath changed, is when my bad breath went away. Lack of concentration is among the signs and symptoms of PKD. Next is difficulty sleeping. So I went through a phase in my life before I started seriously working out. I went through a phase in my life where I could sleep at 10, wake up at 2 till the next morning, and that went on for almost 3, 4, 5 years. It's real if you have PKD, lack of sleep. But as soon as I started working out, I noticed that my sleep improved. And ever since I started detoxifying my kidneys, I noticed that I even sleep much better. Next is sharp pain in the chest. I've had this sharp pain in the chest for about 4 years. These ones always happen most when my blood pressure is the highest up there. The next is nausea, stroke, vomiting. All of a sudden you would eat something and you feel you need to throw up. It happened recently, and the urge to throw up was very strong. That the people around me thought maybe because the food was too hot that I wanted to throw up. But I didn't explain to them because they don't know my condition. Yeah. Swelling in the leg, hands, and around the eye areas. I've noticed when I don't sit down a lot or when I'm more active, I don't go through that swelling of the leg or the arms. For the swelling around the eyes, I feel like most PKD patients have it. There's this upper eyelid always looks heavier. Next is pain in the thyroid and frequent infections. After I came out of the hospital, when I started to have these frequent infections, each time there was an infection that was kicking in, I would start feeling pain in... No. I started feeling pain in my thyroid for some time, and I didn't know why I was feeling pain in my thyroid, in my neck area right here. So after I came out of the hospital, I noticed that each time I would get an infection, the pain would first be in the thyroid area, then next would come the infection. So now I know that when I have pain in my thyroid area, next I'm going to have an infection, and that's how I've learned to take care of the infection before it actually hits. Next is pounding of the chest. I feel like if you can see it right now, you can see it. Before I was diagnosed, like I told you in my previous story, I always had, I would always hear my heartbeat pounding. Each time I went to bed, I would always, even when I turned on the right, though on the right it wasn't as loud as it is on the left. So I most times avoided lying on my left side. I would lie on my right side because I would listen to it less on my right side. Our next is pain in the legs, nerve, and numbness and tingling. So the best way I can explain this is that my kidney is large and it's pressing on some nerves, so I have circulation problems, and I can always feel this tingling and pain in my left side of the body. last but not the least is swollen lymph nodes. So the reason why my lymph nodes are very swollen is because the kidney is not filtering all the waste out of my body. So my lymph nodes have to work hard. So my lymphatic system is basically what I need to take care of to help me recover from this PKD. So I've noticed swelling in my lymphs for a very long time. It's been over, even from childhood. I think from childhood I had a few lymph nodes that were swollen around my neck area, and up to now I still have them. I don't know if they are visible. So, and somewhere around here. I've written down a lot of signs and symptoms. I've talked a lot, and I feel like I should bring this awareness such that a lot of people will be able to know, to help the people around them when they start to notice these things. And thank you for watching. See you in my next video.